Yeah, my name is Klaus Goerlinger. I'm an anesthetist, intensivist, and hemostasiologist. So we worked 26 years at the University Hospital of Essen in Germany in the areas of trauma, liver transplant, and cardiac surgery. And the main topic was bleeding management. And since 3 years, I'm the medical director of TEM International, so the company is producing the Rotem device. The change is from management just blood transfusion, which means you manage the donated blood units, that you always, as a blood banker, has enough blood to supply the clinicians and to have enough blood to transfuse. And that change to not looking for more blood is looking for less bleeding. So what we try nowadays to stop bleeding as soon as possible, to conserve the patient's own blood and to avoid any blood transfusion which is not needed. Because we know that blood has not only beneficial effects. If we transfuse too much or transfuse the wrong products, it increases mortality, morbidity, and also it costs a lot of money. In these cases, you can have bleeding in a short time, so that means also that the patient is losing blood in a very quick time. If you don't know what's the reason for bleeding, you can just add blood, but you don't stop bleeding. It's like a reservoir which holds. You can, of course, continue to put water in, but that doesn't mean that you save some water. The point is that you have to fix the holes. And that is what we are doing in bleeding management. So we identify the reason for bleeding, and then we stop the bleeding within 30 minutes, which prevents that the patient has continuously be transfused. Here first you can use your resources for the patients who really need it. So if you reduce overall blood transfusion, that means you avoid a shortage of blood, but not just to have look for more donors. And of course also you reduce the complication rate. So if we have to do a massive transfusion, we know that's associated with lung failure, with renal failure, which means then again the patient has to stay a long time at ICU. He needs resources like ventilation, he needs dialysis, which again it's a limited resource in even a big hospital. And also that means you can do more cases, which is important for the hospital, and reduce your overall costs and have a better outcome of your patients. Yeah, if we want to move for a more specific therapy, that means you need some diagnostics. So otherwise it's just by trial and error. So you need something which gives you the information within a reasonable time. Reasonable for me, that means within 10 to 15 minutes. And of course, just having the diagnostics doesn't stop the bleeding. You need also interventions, which makes it possible to act in a short time, which you can predict in its effect and has small side effects. And that is that also in the past in Europe we combined point of care diagnostics with, for example, factor concentrates, because that are very good design products which then allows us to do a specific therapy, but this must be guided by point of care testing. Yeah, one of the point of care technologies, that's thromboelastometry. That's the most advanced viscoelastic testing we have actually available, because it gives very precise results, is good reproducible, gives it in a short time, and allows a specific identification of a problem and then a specific therapy. But we know that one blind spot of viscoelastic testing are specific antiplatelet drugs, and therefore we combine viscoelastic testing in form of thromboelastometry with impedance agometry, which is actually the golden standard for platelet function analysis, which also provides results within 10 minutes, and then we even can see if there are specific dysfunction of the platelets based on selected pathway of the platelets. So that's important, of course, in cardiovascular surgery, because there are a lot of antiplatelet drugs, but we know also that cirrhosis or sepsis or trauma itself have an impact on platelet function, and that it needs to be identified and considered for the therapy. Yeah, our concept from TEM International is that we not just want to sell devices somewhere and then nobody takes care about it. So we only go in countries where we have a good partner. Good means for us, it must be somebody who is interested in innovative concepts, who is interested not just to sell devices, is to transfer knowledge. So at least 50% of the job is education. And of course, we need also a partner if there are any technical problems with the device, that the customer is not left alone, so that we can fix any technical problems also within a very short time. That's the only way how patient blood management can work. It's a mixture of technology and education, education and education.